the thyroid gland is one among the 7 endocrine glands in our body. Now the thyroid gland is situated over the neck. All of us know that it is situated over the neck. Now to describe that gland a little more for you, it looks like a butterfly. It's a butterfly shaped gland, and as you all know, a butterfly has 2 wings. So like that, the gland has 2 lobes called the right and left lobe, and is joined in the middle by a isthmus. It is like a bridge. And then if you look more closely, there is a small lobe on the middle of the isthmus that we call the pyramidal lobe. But I think for simplicity, we'll just imagine it as a butterfly shaped organ with 2 wings and a bridge in the middle, and it's situated over the neck. Now usually the gland is not palpable, or what we mean by that is it cannot be felt usually, or it cannot be seen also. And when we can actually see it with our naked eyes, or when we can feel it with our fingers, then we say that this person has a goiter. The goiter is nothing but an enlargement of this butterfly shaped gland. It is a very vascular structure. When I say vascular, it means that it is very richly supplied by blood vessels, and this is why when we operate on the gland, when surgeons operate on the gland, it is a very vascular structure, so it can bleed very profusely. But what is interesting about the gland is that it doesn't have nerve supply. Means that it cannot sense anything, or it cannot feel pain. So it does not have nerve supply, so it's good to remember that. And also what is inseparable from the thyroid gland is what we call the parathyroid glands. These are 4 small glands behind the thyroid gland. And why we are so careful about, or why we take these small glands as so important, is because parathyroids regulate what we call the calcium and phosphate metabolism. Means they regulate the calcium and phosphate levels, which are again very critical elements in our body. So what happens is, why it is important in our discussion today, is that when we do thyroid surgeries, sometimes we run the risk of, in addition to removing the thyroid gland, the parathyroid gland can get removed inadvertently also, and that when that happens, the calcium level starts to fall, and the person can have a lot of problems because of that. So great care needs to be taken by the surgeon to make sure that the parathyroid glands are not removed along with the thyroid gland, because they are so closely packed together. So that is insofar as the anatomy, the location, the blood supply, the nerve supply, and the rest of it is concerned. The function of the thyroid gland is very critical to our body. If someone told me that the thyroid gland is one of the most important endocrine glands in the body, I would agree with that person. Now the reason being, the thyroid gland produces a very important hormone called thyroxine. Thyroxine, mainly it serves to maintain what we call the basal metabolic rate in the body, or in other words, to put it simply, it catalyzes various enzymatic processes or various critical functions in each cell. Body is made up of millions of cells, and in these cells there are millions of processes going on, and to carry these processes forward, there are a lot of enzymes working, there are a lot of hormones working, there are a lot of things happening at the same time. So thyroid hormone is the hormone that acts as a catalyst, and it keeps these processes going, and in doing so it maintains what we call the basal metabolic rate. And this function impinges almost on every other function in our body, because if there is lack of thyroid hormone, or sometimes even excess of it, it can upset this milieu It can either lower the basal metabolic rate or increase the basal metabolic rate, and when that happens, almost every organ in our body can be affected. Say for example, if you're a woman, it can affect the ovaries, ovarian function, ovulation. If you're a male, then it can produce it. If there is a deficiency of hormone, it can impinge on almost every function in that person's body, both male or female. So this is why thyroxine hormone is important. If you take children, for example, thyroid hormone is very critical in growth. So if there is a deficiency of thyroid hormone, these children do not grow adequately, and so on and so forth. So it is one among the most important of hormones that there is in our body. Common disorders that afflict the thyroid gland can be divided into A, hypothyroidism, where there is a deficiency of hormone; B, hyperthyroidism, where there is an excess or surfeit of the hormone. Now, even if somebody does not have these, especially in women, they can have what we call goiters, which is nothing but an enlargement. I told you earlier that the thyroid gland is usually not palpable or imperceptible or cannot be seen. But if the gland can actually be felt or seen, then we call this a goiter. So this is how we categorize thyroid disorders. Then of course there is a more dangerous aspect to it, which is thyroid malignancies or thyroid cancers. So this is how we broadly divide thyroid disorders.